I got on curaJOY through Upwork,
Okay.
and I've been working there ever since. I started off as like an executive assistant, and then from executive assistant to data science, marketing, operations,
Fundraising. Wow.
fundraising, fundraising, all of that. Yeah, I think we are close to 100 volunteers. We have volunteers in the US, in the UK, in India, in Taiwan, in South Africa,
China,
China.
Norway. And what do you do outside of curaJOY, Temi?
Oh, okay. Outside of curaJOY, okay. So first of all, I work with young people as a support worker, which has its very interesting moments. Yeah, but 16 plus mostly. Then, as outside of that, I also run an NGO in Nigeria, also targeted towards young people. So that's one of the reasons that I'm really interested in the Youth Ambassadors program, because for the most part of my life, I've been interested in working with young people, specifically the African setting, because there's so much that young people in Africa do not have access to, that if they actually had access to, they would be far better than where they are right now. And that would have its impact in the continent, in the society as well. So it's not just about, okay, because a lot of people talk about the government doing this, doing that, making employment and all of those things. But you find that because the young people don't have the right resources that they need to be established themselves, either in terms of capacity building or the right skill sets that they need. In computer science, imagine you are teaching a computer science student Fortran. So for context, it's like talking about Stone Age concepts in the 21st century, teaching people COBOL and Fortran that they would never use. But then in other countries that have certain forms of access, they are learning what they need for the future. Yeah, so that's like an example of the disparity when it comes to exposure for African young people. And this is even for those that have the privilege of going to school. Africa has the highest number of unschooled children, unschooled kids. And that is a stat that we can even see. The ones that we can't see in terms of learning disabilities, learning differences, nobody has a clue. We had an outreach 2 years ago where we went to a school to talk to them about learning disabilities, and they were like, they've never heard of that before.
Wow.
So it was like when the sensitization was happening, they could now relate to the experiences of some of their kids. Oh, is that why this girl has not been getting things like fast enough? All of those things, because most are not familiar with this, dyslexia. Most of them are not familiar with some of these um, behavioral differences. So when you are not even in the know of it, how exactly are you going to help the children? When you don't understand it, you don't know it. And one of the things we are trying to do with curaJOY basically is to make sure, first of all, desensitization goes to even underserved communities, and the solutions also get to them. Yeah, so it's not just about the people that can afford it, but the people that don't even have a clue. They can have access to it. They can have the resources that they need to be better. But it just shows that people with these kinds of differences have the potential to be amazing people. But most times when you see examples like that, especially in underserved communities, what you find most times is that they just give up on them. This person cannot be anything in life.
So that's you. What about you, Hayley?
Okay, so my story is, as I was saying, I studied psychology in undergrad and then knew I wanted to work with children, and ended up discovering this field called applied behavior analysis. I typically refer to it as behavioral health or behavior therapy because I think ABA is one of those terms that's not widely known. I mean, case in point, I had never heard of it before starting the job. So, and I loved it. I loved working with these kids and the challenge of having to rely on other ways to communicate beyond just words. And I remember I had one of my first clients, he was nonverbal, like he didn't use verbal language, and he was the sweetest boy. And he kept to himself. He didn't really engage with anybody. It was kind of like he wasn't even aware that other people were around him. And he would make these little sounds. He would go when he was playing or stacking things. And so one day I just imitated him, and he went, and I went, and I'll never forget, he turned to me and looked directly in my eyes. And it was like this moment of awe where it was like he was being seen for the first time. Like he was aware that there were other people in the world that wanted to connect with him, and he was seen. And I mean, that did it for me. I was like, this is amazing. Yeah. And so I had a wonderful career. I went on to get my master's degree in applied behavior analysis, and in 2018 passed the board exam and went on to continue working. I worked in the city of Seattle at a small clinic, and we took a lot of Medicaid clients, which in the US Medicaid is kind of like the state provided insurance if you can't afford insurance. So a lot of low income, a lot of immigrants, a lot of families who had gone a long time needing services and couldn't get access to services. Most clinics don't take Medicaid clients because the insurance reimbursements are so low that clinics actually lose money by serving that population. So it's a huge, talk about disparity. Gosh, I have so many stories from there. I had one client who was 11. He was from Eritrea, and his mom was a single mother of 3. And this boy, he had pretty extreme self-injury. So he had developed scar tissue all along his wrists because he would bite his hands and hit his head. So he had bruises and scar tissue on his head and on his hands. And the mother didn't speak very good English, but we formed a relationship, and she was so thankful because she said she had been on the wait list for 6 years and had been calling once a week for 6 years to try and get her son help.
6 years.
And the difference that 6 years of therapy would have made for this child, I mean, it's horrible. So all we worked on was just reducing that barrier behavior and trying to get him to a place where he was safe. So that was my first job as a behavior analyst. And then from after COVID, things got weird, and I ended up moving to a clinic that was more multidisciplinary. So we worked very closely with occupational therapists, speech therapists, physical therapists. We kind of provided comprehensive services, which was really amazing because for me, I got to learn about all these other disciplines, and every discipline, we all have the same goal of supporting the client, but everybody has a slightly different approach and set of knowledge. And a lot of times I feel like these silos happen where these different therapies, they operate exclusively, and even though they're aware of each other, they're not working together. And it's so much more powerful if everybody is working together and supporting each other. You can just make an immense amount of progress if you're doing that. So that was a really cool experience, and I came on as a lead behavior analyst, and then after a year took on the manager position for the department and did that for about 2 years. And it was great, and also ultimately led to my burnout. I think what I realized seeing every level of the system is that there are so many systemic level flaws that it doesn't matter how great a clinic you're working at or how great the people are, those flaws are still going to be there. And so it was bad. I mean, emotionally, it just wrecked me. I became like a shell of a human because you're just every day, you know that there's families who have been waiting months, maybe even years to get services. And then we're bringing in these entry-level behavior technicians who sometimes have never even had a job. And so they don't understand the gravity of their role in providing therapy to a child with autism. And so we would get, oh gosh, I used to have all kinds of horrible things happen. Like the behavior techs would sometimes call out 5 minutes after the session was supposed to have started. And so then you're trying to explain to an autistic child why they can't come in for a session. The parent then can't go to work that day. And ultimately, it falls on me as the manager to, coach the family through that. And it's just not great. I got really tired of seeing these families let down and just feeling like our clinic couldn't even stay financially like cash flow positive because insurance rates don't increase. So even as like inflation and cost of living increase, insurance reimbursement rates stay the same. So you can't really pay affordable wages to the behavior technicians, which means you can't recruit high quality candidates who really have the right resources and intentions behind being there. And I mean, you can go make more working at McDonald's than you can working as a behavior technician. And it's such a needed service. So I eventually just left and I thought, I'm never going back. I'm not going to be part of this industry anymore. And here I am a year later working at a nonprofit health tech startup for the same mission. But it's wonderful because it has allowed me to emotionally heal because I'm not caretaking right now. I'm not actively serving clients, but I'm still working to support this cause. And I think that's a great temporary solution. So at curaJOY, I am, how do I even classify my role? I'm technically the digital health lead and the clinical lead. So I feel like it's a combination of subject matter expertise and guiding like the clinical development, as well as consulting with the data science team, the UX team, program and marketing, fundraising. And so, wearing many hats. It's very, very fun. So that's a little about my story. How about you, Jess?
That's awesome. My story is not so in-depth. I'm still a student. I'm psychology undergrad, 4th year. And I have long-term aspirations of being a clinical psychologist. And I think working with children and young people as well, because my experience has been working with children. I've also worked as a support worker with children, mostly mental health. And during my placement year, I worked in a secondary school supporting students who have autism and neurodevelopmental disorders such as ADHD. And I'm really interested in behavioural analysis. I actually considered applying for a master's. I'm still sort of in the window of like having time to apply for it, but like you said, there's not really many places even in the UK where you can study the master's for behavioural analyst. But I saw the role and I saw on LinkedIn someone who did that role and they really, really loved it, and they got to work with young people, and then they eventually got into the clinical psychology doctorate. And I thought, wow, that's something that I think that's a path I would like to go down similarly. But then when I thought about actually if I was to do this master's, would I be putting myself in a box and not being able to like do other types of therapy? That's kind of why I thought maybe I don't want to do that. But maybe after having this conversation, you might inspire me to change my mind. But yeah.
I mean, I think it's, I think that obviously there's a lot of need for it, and it certainly brought me a lot of joy and fulfillment. And I also, feel cautious about the state that behavioral health is in, because there's some crazy statistic, like the average BCBA only practices for 7 years before leaving.
Because of burnout.
Yeah.
Wow.
Yeah. And so it's an area where a lot of change is needed. So I think if you go into it just keeping that mindset from the beginning and being aware that burnout is such a real factor, even in the time that I have been in the field, it's changed so much, and it is headed in a much better direction. There's kind of a whole movement that has emerged about amplifying autistic and neurodivergent voices and listening to their experiences, which frankly with ABA have not been very positive. And so the field has been making a pretty significant shift towards more compassionate and trauma-informed care. And simultaneously, this movement of neurodiversity acceptance, which is phenomenal, and I love to see it. So I think it is a better time to be getting into the fields and to be part of that change.